South of Mexico City, there's a place where life is simpler, but fairly hard. The faithful and hard-working people here have hopes and dreams like any of us. But here in Tochimizolco, those dreams often take a back seat to just getting through today. But today is so much better than it was just 20 short years ago, thanks to the vision and dedication of the team that returns each year to lend a hand to this little village and its people who have become like family. Imagine that you're part of this team, that you came here to make a difference. But then you discover that the one who's helped most by this experience is you. This is a story about this place, about this team, and about a week in the spring where the world gets a little smaller. I guess you could call it a love story.
Well, Dayspring started their mission in Mexico in 1987. We all went on blind faith. It was a wonderful experience, and it was there that we met Carlos Romero, who at that time was the VIM coordinator for the Mexican conference. He said, "I have a dream." He said, "I have a dream of a clinic on the side of a mountain in a little village called Tochimizolco, where the people there have no health care."
The doctors were in separate houses in people's homes. They emptied out their homes to be able to receive us, so that a doctor would be with an interpreter and patients would come in one by one, and the houses were all over town. So the intake was in one place, and they would say, "Go down to that corner and turn left." And I remember too that there were no vehicles, very few vehicles in town, a few trucks, and that was about it.
I'm remembering the children in the dental clinic, and we gave everyone a toothbrush as they came through the dental clinic, and the children combing their hair with the toothbrush because they'd never seen a toothbrush before. I think of the families and the tremendous number of drugs for parasites that we gave because they knew nothing about hygiene. There were no latrines. Their toilets were the cornfields. Their nutrition was so poor because they did the best they could with the knowledge that they had.
The first few years we came, about all we seemed to do was take teeth out. And now, this time, I brought instruments, the same number of instruments in sterilized bags that we always have, and there were at least half of them that we never took out of the bag because we didn't even use them. Before, we were struggling sometimes trying to get instruments sterilized so we could use them. But people were coming asking to have their teeth cleaned. The first few years, we were giving them a toothbrush and telling them how to use them. Now they were coming and asking for them.
When the health workers first started talking about toothbrushes, that people laughed and thought it was hilarious. They really had no idea what a toothbrush was for. Now everybody knows what they're for, and they ask for them, and it's clear that they're using them.
I remember the first few years, it was like every single child had a disastrous looking mouth, and there were much fewer this year as far as kids who really had major dental caries, and a lot of the kids either brought with them their old worn out toothbrush, or certainly were using a toothbrush that they had at home.
Probably no other testimonial speaks louder than the fact that only one person out of 30 really got sick this year. And when we first started making these trips, half the team, 2/3 of the team was ill by the time we left the area. And that's happened as a result of health education from the group from Give Them to Eat. But that happened along with the work we were doing.
Having only been here a couple of years, but I saw certainly more patients this time with the desire to be helped with long-term problems. And they begin to sense some hope that maybe there are some things that can happen for them medically. And in some cases it's true just in terms of some additional therapy, but many times just the fact that they have some hope that we might be able to help them they've come asking for things that they wouldn't have asked for probably initially.
I think in terms of the children, I think parents also are much more concerned about issues besides immediate medical problems. There's a lot more concern in terms of, you know, children and their education, their ability to learn, their behavior, suggestions in terms of managing that.
This is the effect of what a long-term project back to the same community by a medical admissions team can do, as opposed to one or two shots in an area. You come back on a regular basis, and the long-term effect of that has been exactly what you've related.
Ok, te vamos a dar otra medicina para el dolor.
Y las piernas.
Ok, cuando te duelen las piernas.
While it's fairly obvious that any medical mission requires skilled medical volunteers, we can't overlook the very important support volunteers, the translators and the people of 1,000 uses, or 1000 usos. Translators are vital to every part of the mission, and their work is grueling. Mexican Spanish is laced with words that have their roots in pre-Aztec languages like nahuatl, and many in rural Mexico just use the nahuatl word instead. Add to that the typical 12-hour days of constantly thinking in two languages, and you begin to appreciate how difficult their job really is. 1000 usos have perhaps the best job because they get to move around as needed. They may count pills and help set up the pharmacy, or process patients through intake with blood sugar and blood pressure testing, and then go fix a compressor pump. Apparently, compressor work is exhausting. But regardless of your job in Tochi, you'll find this experience is life-changing. Whether you've come for years or are a relative newcomer, you're instantly part of this amazing team. And you'll find yourself part of a large extended family.